Welcome to our webinar, Need Help Billing and Therapy Notes? We Can Help. Medical Billing Professionals is an approved TherapyNotes billing partner. Do you have to use TherapyNotes to use our mental health billing service? It is important to stress that providers do not have to be using TherapyNotes or any EMR in order to use our mental health billing service. We have easy online forms providers can complete to provide patient demographics or billing. In addition, we can work with other EMRs like Notes and Practice Fusion. If you are using any other EMRs, you can export patient demographics and billing to provide to us. We do have two levels of service. That's because not all practices require the same level of service with us. You should only pay for those services that you need. We offer Platinum service and Premium Plus. For the Platinum service, we handle all billing responsibilities in TherapyNotes, setting up new patients, verifying insurance benefits, submitting claims, posting payments, following up on denied claims, providing a revenue report upon request. So, setting up new patients. The biggest problem with rejected claims for TherapyNotes users is not setting up the patients correctly. For example, maybe you entered the wrong insurance payer or the wrong ID number. For any new patients, you have a few options. You can set up all new patients yourself in TherapyNotes, or you can complete a simple secure online form on our website. We then will accurately set up the patient in TherapyNotes. Another option, if you are using the patient portal in TherapyNotes, you can have the patients complete the client information form, the client insurance form, the emergency contacts form, the HIPAA privacy notice. Then every day when we log into TherapyNotes, we can download those forms. When we download the client insurance form, we will ensure that accurate information is entered. Quite often, patients go and enter incorrect insurance information on that form. So if they complete the form and attach a scanned copy of their insurance card, we can double check and make sure the correct payer is being entered. If you choose the option where you complete the simple secure online form on our website, you can still set up the patient yourself with basic demographics such as name and date of birth so you can schedule the patient. It is highly recommended that you upload a scanned copy front and back of the patient's insurance card into TherapyNotes if you are not having the patient complete the client insurance form in the portal. Again, we highly recommend that you require your patients to complete those forms and that they be required to scan the front and back of their insurance card. For verifying insurance benefits for any new patients or for patients who change insurance, we will verify eligibility and benefits. We will enter the information on the Billing Settings tab for the patient. The information entered will include the effective date, the deductible, including amount remaining, any copay or coinsurance, any out-of-pocket max, including amount remaining, if claims go to a third-party payer like Carelon Behavioral Health or Magellan, and if prior authorization or a referral is required. If you need to know if a specific CPT code is covered, such as 90847, let us know in advance. Benefit information is entered in TherapyNotes by the next business day. There is a limit of 3 verifications per day and 60 per billing month. There's a fee of $7.95 per each additional verification above 60 during a billing month. On a daily basis, we will log into your TherapyNotes account and submit your claims ready to submit electronic and paper. We will review any claims that may have rejected electronically. If we are able to determine the reason for the rejection, we will correct and resubmit. If we require your assistance, for example, the claim denied because the patient's coverage terminated, we will securely notify you of this so you can provide us corrected information. For EAP billing, we are able to submit those claims to payers that allow electronic submission, such as United, Optum, and Cigna. For payers like Magellan or Carelon that require EAP claims to be submitted via their specific online forms, providers will submit these forms themselves because of the requirement for clinical information. We would recommend for United and Cigna, if you do EAP work, that we set up separate EAP payers such as Cigna EAP, and United Healthcare EAP because of the payer-specific requirements for EAP billing. TherapyNotes as of now does not offer the option to submit secondary claims electronically. If a patient has secondary insurance that is not automatically crossed over by the primary payer, you have to print the secondary claim in TherapyNotes, attach the primary payer EOB, and mail to the secondary payer. However, medical billing professionals does offer the ability for us to submit secondary claims electronically to most payers via our other practice management program. This results in faster secondary payments to you and fewer claim rejections. Some payers reject secondary claims sent on paper, indicating that the primary payer EOB is needed even if you attach the EOB to the paper claim. For payment posting, first we will ensure your office is enrolled with all possible payers to receive electronic remittance advice, electronic EOBs, in TherapyNotes. On a daily basis, when we log into your TherapyNotes account, we will post all ERA files. Prior to posting, we will review the ERA for any claims that denied. For claims that may have denied in error or where we cannot determine why the claim denied, we will automatically follow up with the payer. For claims that denied because coverage terminated or eligibility was not found, we will notify you to provide us corrected or updated insurance information so we can resubmit. For any EOBs you receive in the mail, you will scan the EOBs you receive that are not also found under ERA and TherapyNotes and securely upload them to our website. We will then manually post these EOBs in TherapyNotes. For payers that offer ERAs through another platform but are not available for TherapyNotes to receive, we will download those EOBs from the other platform and upload them into TherapyNotes and then post that ERA file. Your office can easily post your patient payments yourself. However, if you want us to post them for you, we can do that. Follow-up of outstanding or denied claims. Now, assuming your office is enrolled for our Platinum service, follow-up of outstanding or denied claims is included in this level of service. When we post EOBs from payers, if a claim rejects in error or we cannot determine from the EOB why the claim rejected, we will automatically follow up with the payer. For any claims that remain outstanding more than 30 days after claim submission, we will automatically follow up with the payer. If after speaking with the payer, we require additional information from you, such as notes or corrected patient demographics, we will securely notify you. At least once a week, and preferably every day, your office must provide us copies of EOBs you receive that are not found in TherapyNotes under ERAs. Do you pay your clinicians a percentage of the amount paid by insurance? If so, you are probably using the revenue report in TherapyNotes. Upon request, we can provide you the revenue report, separate reports per clinician, upon the schedule you set, such as weekly or monthly. Are you aware, though, that the revenue report is based upon the date of the payment? This can cause problems. For example, if on Saturday the 15th we run a report for the week that ends on Friday the 14th, and then on Monday the 17th we post a payment from a payer with a payment date of Friday the 14th, that payment is lost for revenue report purposes. If we know you will be wanting us to run the revenue report, the way we get around this is by changing the payment date. In the above example, for the payment received on Monday the 17th, to ensure that payment is reflected on the next revenue report, we would change the payment date when posting in TherapyNotes from Friday the 14th to Monday the 17th. So if you are going to be running the revenue report, it's important that at the beginning you notify us of that so we can post accordingly. Premium Plus service. This is what we do with the Premium Plus. We set up new patients in TherapyNotes. On a daily basis, we will review and submit all claims. We will submit all secondary claims. We will review and post all EOBs. And we will provide a revenue report upon request. Verification of benefits is optional, $7.95 per request, and follow-up of outstanding or denied claims is not available. Your office follows up on all claims yourself under the Premium Plus service. Now, we do notify you, though, of all claims that deny an error and require follow-up, making it easier for you to follow up on those claims. For the Platinum service, the setup fee is waived for TherapyNotes users. The standard rate is $3.99 per claim, with a minimum fee of $199.95 per month. If you submit 20 or more claims per week on average, you can consider a 1,000 claim prepayment option for $3.65 per claim. If you submit 40 or more claims per week on average, you can consider a 2,000 claim annual prepayment option for $3.35 per claim. With the annual prepayment option, the number of claims purchased must be used within 1 year. For the Premium Plus service, the standard rate is $289 per claim, with a minimum fee of $99.95 per month. A 1,000 claim prepayment option is $259 per claim. If you do 50 or more claims per week on average, you can consider a 2,500 claim prepayment for $2.19 per claim. Again, with the annual prepayment option, the number of claims purchased must be used within 1 year, and the setup fee is waived for TherapyNotes users. Are you using a billing service charging a percentage? If so, you are probably overpaying. Most billing services charge between 5 to 10% of the amount paid, with the average being 7%. If you are paying 7% and your average reimbursement is $80 per visit, you are paying $560 per claim compared to our highest rate of $399 per claim. If your average reimbursement per visit is more than $80, your savings by using us is even greater. For example, if your average reimbursement is $120 per visit, you would pay $8.40 per visit to a billing service charging a percentage. Some providers don't do their notes every day. If you do your notes grouped together by dates for a patient, you might save. For example, let's say that on April 15th we submit visits for John Smith for April 1st and April 8th. Let's assume you're reimbursed $80 per visit for a total of $160. If you paid 7%, you would be paying $11.20 for those 2 visits. If you are enrolled for a Platinum service, you'd pay a maximum of $3.99 for that claim. Now, a billing service charging a percentage will argue they fight hard to get your claims paid. In reality, follow-up is needed on only 2 to 3% of behavioral health claims. If you submit 100 claims during the month, you would be overpaying on the 97 to 98 claims that are processed without any need for follow-up. You can visit us at mbpros.com/save and calculate how much you can save by switching to MB Pros. We do have an introductory special. If you choose our standard rate, you receive 2 months free if you are using TherapyNotes with a limit of 100 free claims per month. Note, this is for months 3 and 4. Those will be free under the special, not the first 2 months. You also save 10% off our standard rate for the first year. You would pay only $261 per claim. For the Premium Plus service, you would pay only $359 per claim. For the Platinum service, even for smaller practices, you save 10% off our minimum monthly fees. So during the first year for the Platinum service, the minimum fee is only $179.95 per month. For the Premium Plus service, the minimum fee is only $89.95 per month. You can choose a prepayment and save. With our intro special for TherapyNotes users only, you'll receive 3 months free with the prepayment purchase. That's months 3, 4, and 5. It's not the first 3 months. Months 3, 4, and 5. And you save 20% for all prepayment purchases during the first year. So for a Premium Plus service, if you purchase 1,000 claims, it's $207 a claim. If you purchase 2,500 claims, it's $1.75. For the Platinum service, that's all inclusive, including benefit verification and follow-up, you can purchase 1,000 claims for only $292 per claim. You can purchase 2,000 claims for $268 per claim. You have to use the number of claims within 1 year. However, we do extend that by 3 months for the initial purchase, since you have months 3, 4, and 5 free. So at the initial time, you actually have 15 months to use the number of claims purchased, not 12. And again, the setup fee of $99.95 is waived for TherapyNotes providers who bill inside TherapyNotes. That does conclude our webinar. For more information, visit mbpros.com/TN2024. You can see how much you can save again by going to mbpros.com/save. You can call us 877-762-7767. You can email us at info@mbpros.com. Or if you want to meet virtually one-on-one in a pressure-free environment, you can go and schedule a meeting at mbpros.com/virtual. Thanks for attending this on-demand webinar.